Okay, good morning, everybody. Welcome for another YouTube lecture in test and measurements. Today we will be covering chapter 12 on objective measures. And I will pull up my screen now. And here we go. Alrighty, so today we will be talking about objective personality tests. We've been touching on this area number of times through the semester, but let's just have a thorough discussion of it now. We will be talking about response sets and faking, which objective personality tests are really well designed to assess. We will talk about how personality tests are developed along the parameters of objective personality test theory. And we will distinguish between comprehensive inventories versus specific domain tests. Okay? Both of which are used quite frequently in clinical psychology. Okay, these are the debates performances in the recent first round of debates on the first issue. First two rounds in the first issue. And this is, we'll just bypass this stuff that had to do with the midterm exam. And let's start a discussion about objective personality tests by talking about what do we mean by personality? Well, in general, a personality trait is any relatively enduring pattern of thinking, feeling, and behaving. Yeah, that's it, essentially. A relatively enduring way of thinking, feeling, or behaving about one's environment. Yeah, that's a closing, I guess, to the sentence there. Alrighty, relatively is an important emphasis, yeah, because whatever personality trait we define and measure, yeah, the odds are that trait doesn't manifest itself all the time. Yeah, it's something that occurs in most situations, most of the time, yeah, but not absolutely in all situations. So, what would be an example? Example is like being an extrovert, right? So, someone very well is an extrovert in work or at class. With her or his friends, but they might not demonstrate this so much. Maybe when they go to church or temple or mosque, yeah, they're more reserved, or for whatever combination of reasons, right? Maybe practicing their faith it still kind of stimulates other feelings in them where they're less inclined to be socially engaged or environmentally engaged. Yeah. And we have to also keep in mind that personality traits are to some extent situation dependent. Yeah. So maybe someone has a trait of being rude. Yeah. Well, that rudeness is probably only stimulated in certain situations. Yeah, maybe as they're waiting for the bus or they're in line at 7-Eleven or something of that sort. Yeah, but rude people aren't going to be demonstrating their rudeness most of the time with most people. And it's kind of hard to imagine how they would survive in society if they would do that, right? But you can say that there's this trait. It's just maybe more situation dependent. Yeah, whereas something like extroversion, introversion isn't so dependent on the situation. Might vary, as in the example I just mentioned, but for the most part is relatively pervasive. Now, this is in contrast to states. Okay, now states are temporary emotional mood conditions. Alrighty, so you might think of someone being in a depressed state or an anxious state. Okay, now as a general matter, you can describe people who are generally anxious in terms of their personality style or have a depressive personality style. But here we're talking about a different construct, yeah, and that construct is a state, and a state or meaning a temporary condition. And finally, another thing you hear in the personality measurement arena is this notion of types. Okay. Now, types are seen as a constellation, some combination of both personality traits and states. Yeah, so particular combinations we see fairly consistently. Okay. A good example of this, what's a good example of this, but it's not a good test, is the Myers-Briggs. Now, the Myers-Briggs is poorly empirically supported, very popularly used, but not a good psychological test. That said, it is an example of this notion of types, yeah, that people can demonstrate a particular personality trait, like being extroverted, and you know, will have these states that come in and out, okay, with some degree of frequency, like being anxious. Alrighty, so extrovert who's kind of a little nervous kind of a person. Alrighty, you don't hear so much discussion about types these days. Yeah, maybe it's no surprise that it's very common uh, concept with the Myers-Briggs, which is, not a well-supported test, although regrettably very popularly used. And why it's popularly used, it's not super clear. One of the things, to be quite frank, is that like many psychological concepts which aren't empirically supported, they have certain kind of stickiness to them. They're ideas that kind of stick with people. Because they may be appealing, they may have some kind of intuitive, it resonates with people on some intuitive level. But that said, right, there are some things that are uh, appealing to our intuition, which may be empirically supported, but there are certainly things which may appeal to us intuitively, which are not empirically supported. Okay, so objective personality tests, these are some of the main characteristics. One, they are scored objectively, like through a Scantron or through a computer Scantron. Okay, so it's not going to be an essay in which a judge, reads through it and then comes up with her or his judgment based on their experience. Alrighty, or someone drawing something and then a judge or clinician doing similarly. All right. It's based on um, the other characteristics, selected response items. Yeah, and as you may recall from, I think it was chapter 6, that selected response items are items that limit the examinee's responses, right, to something like a true, false, or multiple choice answer. Right. So because they're selected response items, the way to efficiently score them is by way of objective scoring, yeah, as to a Scantron or computer scanner and so on. Now, where are these tests used? Okay. Now, when it comes to personality tests, they are the most used. In particular, the most used personality test in the world is the Minnesota Multiphasic Personality Test. We'll get into the specifics of that test in a moment. Okay, they're obviously used to assess personality traits and characteristics, like some of the examples I just mentioned. Um, they could be big five characteristics. We'll might touch on that notion a little later, and or larger personality traits that have been discussed for about 100 years, maybe almost 100 years. Things like introversion, extroversion, conscientiousness, openness, and all that kind of stuff. Now, those traits have been discussed prior to the last 100 years, but in terms of being discussed as psychological constructs, a lot of these ideas have only been talked about really extensively for maybe about 100 years. Alrighty. They are frequently used in the forensic setting, yeah, both civil and criminal. And the appeal or attractiveness of objective personality tests in forensic settings, yeah. Well, first of all, they may be used in things such as, the criminal proceedings, such as in the insanity plea, fitness to stand trial. And one of the reasons why um, objective tests are very popular in forensic setting is that with the objective test, you can get quantifiable data on issues regarding possible faking. Okay, we'll look at that in a moment. All righty, but it's also used in the civil setting, right? Like in personal injury claims, child custody, to evaluate, parents' personality styles as they may relate to, like, say, child custody issues. In law enforcement, it's frequently used to evaluate candidates for the law for the police force. In some instances, not some instances, in many instances, it's used in applicants for religious orders for the priesthood. You have to assess their personality, and because you want people who are applying to the priesthood who are emotionally stable. Yeah, you want to get a sense of what their personality traits and issues may be. Okay. And finally, personnel selection. Yeah, employment. It's not uncommon to use some kind of objective personality measure for either hiring or promotion. Yeah. And it may be part and parcel of selecting people for certain positions, maybe to be a vice president of a large corporation. Yeah, because the corporation wants to have someone who's emotionally stable, and objective personality tests can provide that kind of data. Now, there are two types of objective personality tests. The first are comprehensive, what are referred to as comprehensive inventories. Okay. Examples include the Minnesota Multiphasic Personality Inventory. Another is called the Milan Multi-Axial Clinical Measure. What's another one? California Personality Inventory. Those are some of the big ones. Yeah, the ones you'll commonly run into. Right. These tests tend to have a high number of items. Offhand, I think the MMPI is about 567 items. Most of these they're called inventories because, well, they sure feel like inventories when you're an examinee, because they do a really thorough accounting inventory of one's behaviors, which are correlated with behaviors, attitudes, beliefs, likes, dislikes, which are correlated with different personality traits. Okay, and so in order to do this thorough accounting or inventory of the person's of the variables I just mentioned, yeah, it usually involves at least a couple to a few hundred items, asking about various things from the individual. Okay. They typically take anywhere, if you're lucky, about 30 minutes, but usually about an hour, hour and a half to complete. They produce a variety of scores. We'll see how that's very much the case with the MMPI. And the scores are used in a whole bunch of applications that as we just described. Now, the other category of objective personality tests are the specific domain tests. Now, as the term implies, a specific domain test is measuring a specific construct or concept. Yeah, classic one will be depression, like the Beck Depression Inventory, or anxiety, like the State Trait Anxiety Inventory. Yeah, those are two very common domain tests, but there are hundreds of domain tests measuring all kinds of different constructs. Okay. They tend to be relatively brief. Like the Beck offhand is about 21 items. Yeah, true Likert scale items. You can complete them usually in about a couple minutes. They typically produce just one score: depression score, anxiety score, assertiveness score, like the Rathis assertiveness scale. We might complete one in class. So there's a very specific targeted purpose. There's some specific construct, domain that the examiner wants to measure. Yeah. Unlike the inventory, so the Milan, the Minnesota, the California personality inventory, they typically have very large they have normative tables based on large normative groups, usually in the hundreds, if not thousands. Yeah, not so much with the specific domain tests. They tend to be based on smaller sample sizes, like a few hundred. Yeah, but that's usually fine because you're dealing with a test which is maybe 21 items. So you don't need to have thousands of people to, establish reliability and validity. A few hundred will probably do the trick for a 21 item test. Response sets and faking. Okay, very interesting, kind of a, do I dare say, fun area in psychology. What response sets and faking are, well, first of all, let's talk about a response set. A response set, as the term kind of suggests, indicates a particular pattern or style or manner of answering questions. Okay. And there are different kinds of response sets. Some subjects may demonstrate a social desirability response set. Yeah. In other words, endorsing items so that they look good or normal, quote unquote, normal. Yeah. There's also another response set where maybe someone's not inclined to look normal or good, adjusted, right? But they just like to agree or disagree, yeah, with what the items are stating. So you might have just a whole bunch of true endorsements and yeah, that's me, or just disagreeing to be, either as a function of defensiveness or just frustration about taking the test. Alrighty, so those are some of the things objective personality tests are really good at assessing because they can compare the pattern as demonstrated in the selected response items, true, false, multiple choice, Likert, and compare it against normative data to see if the person demonstrates a significantly high degree of social desirability, or significantly high degree of agreeing or disagreeing with items, compared to the normative sample. The other thing, concept which is really relevant to objective personality tests, is the issue of faking. Now, faking, when you hear that term, it certainly may mean very similar things in and out of psychology. But in psychology, it specifically refers to the conscious intent to present a certain presentation. Yeah. So it may be to present a favorable presentation, like one is adjusted, one is emotionally stable. Yeah. And this might be particularly important, as mentioned earlier, in pre-employment screening. Yeah, either for hiring or for promotion, and so on. Or if someone's going for a particular occupation, like a police officer, in the military, maybe it's a particular position, like to be a spy, or to be in intelligence. Yeah, not intelligence IQ, but intelligence in terms of gathering information about the other side. Alrighty, there may be psychological objective tests which are administered, and certainly the person who wants that kind of those kinds of positions will want to present a favorable impression. Yeah. But people may also be motivated to present an unfavorable impression. Yeah, they want to present as being sick, unstable, and so on. Situations may be, as mentioned before, in the forensic setting. Yeah, if someone is going for the insanity plea, they may very well want to present themselves as being mentally unstable or suffering from a mental illness, yeah, in order to support their defense of the insanity plea. Another concern is in personal injury. Yeah, if someone experienced, like for example, workers' comp, yeah, where employees can be compensated for healthcare costs that arose due to some kind of injury at the work setting. Okay. Now, injury, we typically think of workers' comp and injury as resulting from a physical injury, but it also relates to a mental injury too. Yeah. So because maybe of the stressor set up at work, which could have been avoided, the person is suffering depression or claiming to be suffering from depression. Yeah. Well, the person who's making that workers' comp claim, saying that they're suffering from a mental disorder or mental symptoms as a function of how things were set up or inappropriately set up in the work setting, they very well may want to present a unfavorable impression when psychological testing is done, which is what is typically done in these kinds of cases. Now, what are some of the strategies that objective personality tests can use in order to assess response sets and faking? Well, as mentioned before, these tests typically are made up of the comprehensive tests are typically made up of, and by the way, let me take a step back. In terms of assessing response sets and faking, it's usually almost maybe exclusively the comprehensive personality tests which do this. Okay, not so much the you know the state um, you know brief measures. It's rather the comprehensive larger measures. Okay, and why is that the case? It's because in order to assess response sets and faking, you need hundreds of items. Yeah, in order to establish patterns of test taking behavior or responses. Alrighty, a 21 item measure won't be able to do that, but something which has like 567 true false items is you can be very good at finding patterns of responding. Now, what are some of those strategies? Quantitative statistical strategies that objective personality measures use. They include extreme empirical frequencies. Now, what those are, what that refers to is looking at the frequency of responses being endorsed by the examinee. So, for example, in the MMPI, there is a factor, a depression factor, okay, to measure, obviously, depression. But what the test can do is it can determine whether the amount of depressive symptoms endorsed by the individual is statistically significantly more than what the average depressed person would endorse. Okay? Because the average depressed person will endorse a certain number of items, but the majority won't endorse every single item. Okay. If someone's endorsing every single item, yeah, that's a red flag that you might have faking going on. Yeah, faking bad. Another strategy is using response consistency. Yeah, and you can think of this kind of like along the lines of the old what we think of as a police interrogation style. Yeah, interrogating someone for hours to seeing if they respond similarly, right? If they say if they're what is it, their excuse, their story for how they couldn't have committed their crime, their alibi, is it consistent? Yeah, when they say they were at their friends at 2 in the morning, when you ask them again, do they say 2 in the morning, right? And if there's inconsistencies, that raises a red flag for the police officer. Well, objective personality tests kind of do the same thing because they do ask many items a number of times to examine consistency. Now, understandably, most of us, just as in the police interrogation, will never be 100% consistent, right? Because we misspeak, our memories might be a little fallible, right? But usually, not to the extent that if we were in Hawaii, we say we were in Idaho, right? That's a big inconsistency. But we might say 2 in the morning in one instance, and then 30 minutes later, we might say 3 o'clock. Those departures from consistency usually won't be a red flag on an objective test. Yeah, but if there are several items where someone is talking about being, happy, content, satisfied, and then a few items where people are saying, they're severely depressed, they have no motivation, that's the kind of inconsistency, a number of inconsistencies that need to be demonstrated for a red flag to be raised regarding response consistency. Balancing item directionality refers to test construction. Okay, that a good test will have items that are measuring a construct in one direction and then measuring it in another direction. So what's an example? Let's just say if you're measuring assertiveness, yeah, if you want an item that measures it, you might ask a true false question. And the item might be, most people seem to be more aggressive and assertive than I am. If the examinee endorses true, right, that's in the direction of um, being unassertive. Okay, so they would write true. And then you would have another item: when this food served at a restaurant is not done to my satisfaction, I complain about it to the waiter or waitress. Okay. Now, if the person is unassertive, they would probably answer false, right? So we got two items, but we're balancing the directionality. Okay. In one sense, in the former, right? If you're unassertive, you'd endorse true, and in the latter, if you're unassertive, you've endorsed false. Okay. So you want items, that go in different directions, because if the person is engaged in the test and answering genuinely, as they would think or behave, right? They should be answering in different directions in that case if they are unassertive. True in the former, false in the latter. Okay. If they're not paying attention, or if they're not truly unassertive, right, we would get two trues or two false responses. And with the objective personality measure, the comprehensive measures, you can find where they're inconsistent, yeah, where they should be answering differently, right? And if we see something weird, like they're answering true to both or false to both. Okay. Other ways you can measure responsiveness and faking is, for example, in a test in which people have to choose between item A or item B. Yeah. And one of the ways you can assess whether you can kind of offset or avoid, a response that, let's say, social desirability, is by making choice A and choice B equally desirable or equally undesirable. Right? So that's what that fourth strategy refers to. Now, with these four strategies, what do you do with that data in the test that you got from the examinee's responses? And you find these patterns, yeah, going one way or the other. What you can do is either use that as well, the test will, right, as it's scoring it, will either adjust scores, either increasing or decreasing scores along different scales, yeah, and or the test can inform the examiner whether the responses, the patterns are showing, suggests an invalid or valid profile. Alrighty. So in the former, whether it's something that is questionable, you really can't use, or whether it's valid, and the data from this test can be used because it's valid. All right, a true measure of the person's attitudes, beliefs, behavioral patterns. Okay, how are personality tests developed? Objective personality tests. Well, there are four general methods. One is the content method. Yeah, finding items that are whose content, yeah, matches the construct of interest. Yeah. So, for example, if it's extroversion, introversion, a clear example would be, I am open and frank about my feelings, right? Which is probably more uh, a, um, an example of someone who would be extroverted, right? Someone who's open, sharing, all that kind of good stuff, engaged with others. Alrighty. So finding content that is clearly matched with the construct of interest. Okay. If you have a depression scale on your personality test, you would want to include content um, which really characterizes depression. So you'd want depressed mood items, depressed thinking items, and depressed physical symptom items. Okay, so mood might be I feel sad most of the time, true or false. Um, in terms of what was it? Mood, thoughts, right? I An item might be true or false. I think I have no. I think there's no hope for me to do things differently. And then a true or false biological or physical symptom would be uh, I have a hard time waking up in the morning, true or false. Now, the criterion king approach refers to a way of developing a test which involves presenting when developing, making the test, right? Getting a sample of people, and then throwing out a whole bunch of items, right? Which may or may not be related to the construct of interest, but in the end, right? Correlating those items and by way of factor analysis, I'm sorry, let me take a step back. Factor analysis is the third approach. Criterion approach, and just seeing, you know, and then seeing connections, correlations among the different items. Alrighty, so that's the criterion king approach, which is very similar to the third approach I'm going to discuss, factor analysis. Okay, so you might just be seeing correlations among items, or which is what's typically done when you do these kind of correlations, you run a factor analysis, right, to see if the intercorrelations among the items, yeah, factor into certain groups, which is what happened in the case of developing the Minnesota Multiphasic Personality Inventory. Okay, when it was developed, several hundred items were given to a couple of, I think it was a couple thousand individuals, both quote unquote normal and quote unquote not normal, being psychiatric patients. Yeah, and then to see, which group, how they endorse, which group endorse which items and how they endorse those items. Yeah, and what they found was that the items would be grouped into certain factors or groupings. And based on the items that grouped together, each factor was named or titled based on what they had in common. Yeah. And so they found that there were a whole bunch of items, maybe about 30, 40 items that were all related to depression. That there were a whole bunch of items that were whole related to being antisocial or being deviant. Yeah. And deviant not necessarily meaning in a bad way, right? But just deviating from the norm, which could be a good thing in terms of creativity, thinking critically, and all that kind of good stuff. You can also develop items that are theory driven. So you might have a theory, well, this is how the Myers-Briggs was developed. Not a good test, but just to, but good for this example to lay out how a test can be constructed. Yeah, in the end, it wasn't constructed. The data isn't so great to support it, but the way it was constructed kind of illustrates the theory-driven approach pretty nicely, in that it was based really on Jung's uh, theory of personality. That there are certain factors like being introverted, extroverted, or being conscientious, or being open. Yeah, that these types of personality traits exist, and that there's certain behaviors associated with them. Yeah, being intuitive and so on, as opposed to being analytical. Those were Jung's ideas. Well, other people had those ideas, but he put it together into a personality theory. And that's what the Myers-Briggs in large part was based on, the notion that there are these factors based on Jung's notion of personality. Okay, and many tests are actually a combination of these different methods, and like well, the Minnesota is mostly criterion keying and factor analysis and content, not so much theory driven. Yeah, but you can also have other tests which utilize all four to varying degrees in order to construct the personality test. Okay, in terms of comprehensive inventories, the one I'm going to be talking about is the one that's most used in the world. And the one that's most used in the world is the Minnesota Multiphasic Personality Inventory, or MMPI. And let me just take a green tea break. Thank you. Now, when the MPI was developed, yeah, as mentioned earlier, and I'll just refresh your memory very briefly, what they did was that they got two samples of subjects, psychiatric and non-psychiatric. The non-psychiatric were family members of psychiatric patients at the Minnesota University of Minnesota Teaching Hospital. And they presented several hundred items to all the subjects, to both groups, to see how those items would be different between the two groups, but also within the psychiatric population, how depressed patients, patients suffering from schizophrenia, and so on, how they may differ in their response styles. Okay. Now, the original intent was to develop a diagnosis kind of test, a test that patient could take, and then it would generate a diagnosis, resulting in saving a lot of clinician time, from having to make diagnoses. Well, what they found, unfortunately, was that the test wasn't a diagnosis machine, and that to do diagnosis, it really did involve someone sitting down in an interview and having to assess someone in order to make the diagnosis. That said, they did find that inadvertently they had come up with a really good personality measure. Okay, the original one consisted of 504 items that seemed to be helpful, that subjects would endorse either true or false. Okay, the statements differentiated clinical and normals, and also from the test, they were able to generate different factors, about 10 clinical factors, and there are other factors related to faking and response styles. But of the 10 clinical factors, it would produce 10 scales, which examinees could be either high or low on in varying ways. So people would have 10 scales, which would vary in terms of how high or low examinees demonstrated on each of the factors. Okay. Now, these are the 10 clinical scales. Hypochondriasis, which refers to being focused on physical symptoms, depression, hysteria, which you can kind of think of as an anxiety um, scale. They use a very archaic term for anxiety, which is hysteria, which arises from psychoanalytic theory. The fourth is psychopathic deviant. The fifth is masculinity, femininity. Okay, and this is the extent to which one endorses stereotypical masculine or feminine traits. Okay. The sixth factor is paranoia. Seventh is psychasthenia. Now, this is another old term, which really kind of refers to kind of well, another old term, but one that people may be more familiar with, neuroticism. Yeah, you can kind of think of this as neuroticism or kind of a neurotic personality style. You can kind of think of, for those of you who remember Seinfeld, think of George Costanza from Seinfeld. Okay, he would be very high on the psychasthenia scale. 8 refers to schizophrenia, 9 to hypomania, hypomanic symptoms, and 0 for introversion, extroversion. Alrighty. Now, what's important to keep in mind, is that with these scales, you they allow you to assess these different personalities traits on a continuum. Yeah. So it's not like a yes/no dichotomous thing. Yes, you're depressed. No, you're depressed. Okay. It depends on how high, and it not only just generally depends on how high, but it really does. It depending on how high or low one is on a continuum, it really suggests different possible behaviors or attitudes from the individual. Alrighty, so it's not just more or less depressed or more or less paranoid, but or more or less schizophrenic, but it indicates to what extent the types of behaviors or attitudes associated along the continuum. Yes, it's not just simply degree, which we'll see in a moment. Okay, this is a discussion on the Big Five, which we may have next time we meet. Alrighty, let's look at one of the scales. This is one of the validity scales, which we'll talk about in a moment. It's called the lie scale. Yeah, well, we kind of talked about it earlier when we were talking about faking and response styles. Okay. Now, as the lie scale kind of suggests, it refers to one who is covering up, yeah, um, avoiding disclosing things, and so on. Yeah, just like the word lie implies. Okay, if they're trying to present themselves in a positive light, so they're hiding, not disclosing, um, you know. Uh, flaws, and so on. Okay, negative aspects of themselves. Okay, so if you endorse, now what would increase the lie scale? What would increase the lie scale if someone endorses false to some of these items? Okay, once in a while, I think of things too bad to talk about. False. I never think of things too bad to talk about. Hmm. At times, I feel like swearing. False. I never feel like swearing. Yeah, right. I do not always tell the truth. False. I always tell the truth. I do not read every editorial in the newspaper every day. I read every single editorial in the newspaper every day, and so on and so on. Okay. Now, as we're going through these items, some of you may have felt that, hey, I would have said false on that particular item. Don't worry. Doesn't mean that the MMPI would have then labeled you as a liar. Okay. There are about 30 or 40 items that go to the lie scale. So you gotta write for a number of these items, right? So for some of these on the items, some of the lie scale items you need to endorse true to increase the lie scale. I'm just looking at the items, discussing here the ones where you endorse false. It will increase the lie scale. Okay, so it's not just a matter of endorsing a few items that will, elevate the lie scale to a point where it will be determined that you're lying. Yeah, you got to endorse a whole bunch, okay, a majority of the items. All righty. Um, Oh, and just mentioned before, just mentioned earlier, it depends on how high too. If you're really high in the scale, it's going to indicate that, you're fabricating things. It's evidence to support. Yeah, it is not like a lie detector test. It's called the lie scale, and that's probably why judges and lawyers love it, because it kind of fits with, their concerns. Um, all I can tell you is that if you're significantly high in this scale, yeah, is that you are probably hiding stuff that's negative about you. Yeah, and ultimately, if this is super high, ultimately what the test is saying is that the test is probably not valid. Okay, whether you're consciously, intentionally lying, yeah, as experts in the area of forensic psychology will tell you, yeah, no one test will do that for you. Okay, um, whether it's a personality test or otherwise, yeah, you need a number of pieces of evidence to support the assertion that someone is malingering or faking in one direction or another. Okay, and that goes for the MMPI. Even those called the lie scale can be a little confusing. If they're significantly high on this in one direction, it doesn't allow the clinician to professionally or ethically say this person's a liar. Okay. What you can accurately say, scientifically accurately say, is that the test is not valid, whatever's being presented. Yeah. And that this could go to lying, but that you need more evidence to support that. Yeah, what would be an example of more evidence? If they have a history, if criminal history, right, of like say fraud, right, writing bad checks. If family members, co-workers have reported the examinee making incorrect, inconsistent statements, something of that sort. Not just incorrect. Incorrect could suggest that they're just not so bright or they make mistakes. Here are items. If you endorse true or false on these items, they increase the psychopathic elevation on the psychopathic deviant scale. Okay. Now, psychopathic deviant doesn't necessarily mean like you're Jeffrey Dahmer, all righty, and you're about to kill and eat people. But what it does, it is certainly a measure along that continuum. Alrighty, it doesn't mean whether you'll be a Jeffrey Dahmer, but whether you may have certain traits similar to or as intense as Jeffrey Dahmer, depending on how high you are on the scale. But actually, mild or moderate elevations on the psychopathic deviant scale may actually, depending on other scales and also other evidence, may actually be indicative of high intelligence or creativity or being able to not be bound by formal rules. Yeah, the person may be absolutely law-abiding and a decent person, but they can think differently. They can depart from uh, normal thinking, yeah, or adherence to rules. Okay, but they just might do it in an adaptive way. Alrighty, endorsing true on any of these items, A, B, C, or D, yeah, will increase your psychopathic deviant score. So if you, I'm sure I got a raw deal from life, true. At times I very much wanted to leave home, true. No one seems to understand me, true. Now, but if you endorse false, this will also increase the psychopathic deviant scale. My daily life is full of things that keep me interested, okay? False. My sex life is satisfactory, false. I've never been in trouble because of my sex behavior. Oof, false. If they kind of oof, if they say false with that one. Okay. We'll pass the masculinity, femininity um, scale, but ultimately, if you endorse true or false on this item or true on these items, if you're a male, increase your masculinity uh, um, it, it will increase your the scale on the masculinity femininity scale, meaning that you're endorsing more uh, uh, stereotypical male behaviors. Although there are some odd items like this one. I would like to be a singer. If you endorse true, it increases the scale. And that's kind of a nice point, or I think I would like to the work of a librarian. If you endorse true, that increases your MF scale, suggesting you endorse stereotypical masculine behaviors. And those items seem a little odd, yeah? You wouldn't think that endorsing true on those items would increase the scale, suggesting you endorse stereotypical masculine behaviors. Um, but that's part of the criterion king approach that's mentioned earlier. Yeah? It doesn't matter if it doesn't fit intuitively to what we would think. Yeah? It's ultimately empirically driven. Yeah. So if the test construction, right, sample, a correlation was found, yeah, suggesting endorsement of this item increases the MF for a male, then that item stays there. Is it going to be in the test? Okay. Even though it doesn't make intuitive sense, nor fit a theory of masculinity, femininity. Okay. It empirically operates in that direction. And we have the same thing for females. Yeah. And interesting, those same two items contribute. Alrighty. This is another example of schizophrenia. And I think I'll just kind of move on here. We might touch base on this if when we meet face to face. Now, as mentioned earlier, the MMPI is not a diagnosis generating machine, yeah, or test. But if there are certain elevations in 2 or 3, sometimes even there may be more than 2 or 3, but it's typically 2 or 3 scales. Yeah, it lends evidence to the presence of a particular diagnosis. Yeah. So, for example, if someone has elevations on scale 2, depression, and 3, what was 3? 3 was no, that's depression and hysteria. Yeah, on those 3 scales, it suggests that they're probably suffering from a mood disorder. It doesn't tell you what specific mood disorder. That's up for the clinician still to have to assess, but it provides evidence and support that they're probably suffering from a mood disorder. They have elevations on 4 and 9. Yeah, 4 being psychopathic deviant and 9 being hypomania. Yeah, it suggests that there's some kind of conduct problem. Yeah, with adolescents, it may be more of an adjustment problem. With adults, it may be suggestive that they are suffering from antisocial personality disorder. All righty. Or maybe it's more correct to say they're not suffering from antisocial personality disorder, but others are suffering from the fact that they have antisocial personality disorder. All righty, that the examinee as that is maybe diagnosable for that. All righty, so that's the idea that based on elevations, yeah, so it's looking at the personality profile, all righty, suggests the presence of the probability of a particular diagnosis. And these 2 or 3 point codes have become more reliable than any single scale. So you can't rely on just 2 for whether someone is suffering from depression or not. Yeah, it's you got to be looking at 2 and 3. Now, it's important to point out that the MMPI has been revised. It's now in its second edition, and in about 1989, it's probably due for another revision pretty soon. And I believe one's in the works. And the reason why it was revised, and this is important for us in a test and measurements class to understand the reason for it. One was the inadequacy of the original standardization sample. As I mentioned, it included only individuals involved in the University of Minnesota's uh, teaching hospital. One, psychiatric patients, right, were identified as the not normal, which isn't so much of a problem, right? Utilizing actual psychiatric patients as at a hospital, but then using as the comparison group, right, family members, and so who are non-psychiatric. So there are clear, research issues concerning that, as opposed to using a completely separate comparison group. Yeah, which are similar along other demographics, which is probably the motivation with the original sample, right? That the family members would be kind of similar along different demographics, but certainly concerning, okay, well, but what is still kind of concerning is the fact that because they're related, how does that make the quote unquote normal sample different from the general population? The original MMPI had very kind of old-fashioned terms and language, which was just out of date and wouldn't make too much sense to a contemporary, contemporary meaning in the 90s, uh, examinee. So it made reference to sleeping powders and streetcars and a game called Drop the Handkerchief, which I have absolutely no idea what that game's about. So, so because of that, and that clearly would have a negative effect with examinees in terms of they're just not understanding what the item's about. If they don't understand the items, you're not going to be able to sample their behaviors and attitudes. Those items were changed. Okay, a lot of items were objectionable the way they were worded. Many were very sexist in nature. Okay. Plus, also what was included, which was not included at the time, a number of items which would allow for assessment of substance abuse, suicide, suicidal behavior, as well as treatment-related behaviors. Yeah, like willingness to participate in psychotherapy and utilizing medications. Okay, and moving right along. So here's an example of an MMPI personality profile. Here, you can see the 10 clinical scales, and here are the validity scales, which I'll explain in a moment. Now, the way you interpret an MMPI, yeah, is not it's not categorical. It's not just yes or no, right? It depends, right? It depends on where the person lies on each of the scales on a continuum. Alrighty. Now, normal functioning is seen as scale elevations within the T-score of 65 and 50. Okay, T-score is just another kind of standardized score, like a Z-score. Okay, 65 and 50. Anything within here is seen as um, presence of particular behaviors and attitudes related to each scale, which is not of clinical concern. The thing that raises attention for purposes of personality interpretation or test interpretation is anything significantly low, below 50, or technically significantly high, above 65. Yeah. But the way you interpret it depends on how high or how low the elevation may be. Yeah. So, for example, here we have someone who's significantly low on D, depression. Okay. So that kind of tells you, okay, they really are not depressed. They may have other stuff going on, but they're not in a depressed mood. Okay. Uh, and let's see here. And their lying is very low. Okay, so that's a little odd. Doesn't mean that they're super duper honest, right? If they're lying, it'd be high, but right. But here, because it's below, it's kind of suggests, okay, that's kind of interesting. They may be particularly inclined to say stuff about themselves, which is maybe a little odd. Okay, something to look out for. Hard to tell when it's just a little below average. What's interesting here is elevation in psychopathic deviant. Okay, but it's not like super high. Like if it was up here, then you'd be really concerned about someone who's a severe sociopath. Okay, they may not be Jeffrey Dahmer, like a serial killer who eats dead bodies, but it may be someone who has a very concerning commonality with a Jeffrey Dahmer. But when it's like this might be someone who just thinks a little differently. Yeah, who's not going to be so rigidly bound by rules. Okay, here we can see the paranoia is a little higher. Okay, but it doesn't mean that they're suffering from paranoid schizophrenia. That would be something like up in this region, if it was that high. Here, this might be someone who's just a little neurotic, right? Little not trusting of people. And here, the schizophrenia is a little high, okay? If they're suffering from full-blown schizophrenia, it'd be probably more in this region, all right? But here, this might be someone who just thinks a little odd, maybe a little creatively, yeah? Is an artist or musician, yeah? By trade, or just, someone who's very creative, all righty? It may. Or it may be something related to idiosyncratic thinking. Yeah, just a little different. Yeah, but not problematic. Okay, let's see. Yep. Okay. Now let's talk about the validity scales. Now, what the validity scales refer to is what was discussed before, whether based on the pattern of responses, yeah, whether the test you have before you is valid, and if it's invalid, in what manner may it be invalid? Yeah, this is a very unique feature of the MMPI, but I think the Milan multi-axial Milan clinical MCM. I think it's Milan Clinical Multi-Axial Inventory, MCMI, pretty sure. And California Personality Inventory, I believe they also have similar types of validity scales. Okay. Now it's used again to detect deviant or invalid test taking, and there are a number of different scales, but I'm just going to touch on the main ones that people most likely will encounter or read about. Yeah, it's the cannot say scale, the lie, fake, and defensiveness scale. Okay, now here we can see big elevations on the F scale. Okay, this person's topping out here, which kind of tells you that they may be faking bad, right? They're faking like they're sick, like they're suffering. And in this case, sick would be because there's a psychological measure, right? They're endorsing psychological symptoms. So you can see, yeah, and then when you look at the clinical scales, everything is high, yeah? The only thing is their masculinity, femininity is like normal. They're not endorsing any feminine, masculine stereotypes, right? But here, right, almost everything under the sun, it seems to be a problem for this person, which suggests that they're trying to present themselves as really, really sick. Okay. And here's another one where the validity scales all valid. Yeah. We'll talk about this case scale in a moment. But here you see spikes which are typical of someone who's suffering from some kind of mental disorder. So we can see depression is high, hysteria is high, right? Um, they're not suffering from antisocial kind of features, right? Everything else is normal. The other thing that spiked is psychasthenia, right? So they may have a particular nervous, anxious personality style. Yeah. So this is a very common kind of valid MMPI profile. As an aside, when depression is high, yeah, it may certainly be indicative of depressive symptoms, mood disorder, but it also is, from a psychotherapy standpoint, um, positive in the sense that here you're dealing with someone who may be motivated to participate and be involved in treatment, which is important if they have symptoms that they be motivated to be in treatment. And depressed people are, yeah. So those suffering from depressive symptoms are in pain, they're suffering, and they want to feel less pain. So that's a motivator to be in therapy. Yeah. Whereas that other situation where the person was below average, right, that's actually a bad sign. Yeah, because if they're suffering from some problems, which we saw, they may have been suffering from some stuff. The MAPI is telling you, ooh, this might be a hurdle, right? Because the person is so below average on depression, right, that they really don't care to be in treatment. They're not interested. They're not motivated. Okay. Now, what this demonstrates, this is actually an MMPI from someone, which, you can see this validity score super high, but what this is, actually, the yellow and the red line um, indicates a pattern that was taken by an examinee who took the test twice, and they took it over between 2 years. So first test administration, I think was yellow, was done at one point, and then they took the MMPI again 2 years later. Okay. What unfortunately seems to be the case is that this person's still faking. Okay, maybe even more so if the red is the second test administration. I'm not exactly sure which one's which, but let's just say for now, you know, to illustrate the point. The red represents the second testing. You can see they're faking even more. But what's more interesting, regardless of whether yellow is the first or red is the first, is the pattern is very similar. So the person is faking in a very not common, but a similar pattern to what they did the last time around. Okay, well, let's talk about the validity tests, validity scales. Yeah. The first is the cannot say scale. All righty. And what the cannot say scale refers to is whether the person is omitting a significantly high number of items. Okay. Now, when you're taking about 567 true false items, you're bound to miss some, right? You might go from item 260 to 262, right? Skipping 261, just as by way of human error. Alrighty. Or, sometimes people don't want to answer some items. That happens. Alrighty. But if there are a significantly high number of omissions, okay, that will show up on the cannot say scale. Okay. So it's kind of like, hey, I cannot say one way or the other. And it may be mild, it suggests mild indecisiveness, or really just full-blown outright evasiveness. All right. So it depends. Again, it depends on how high they are on this scale. The lie scale, as mentioned earlier, reflects an unwillingness to admit to obviously minor character flaws. Okay, so if they would say, I do not read every editorial in the newspaper, false, I read every editorial in the newspaper. Who does that? In this age, who reads a newspaper, regrettably? I do not like everyone I know. False, I like everyone I know. Really? Right? So again, one or two of those endorsements won't kill you. But if you endorse, as I mentioned before, the lie scale is composed of about 30 to 40 items. And if you endorse a whole bunch or the majority in that direction, it elevates your lie scale. Now, the fake scale refers to specifically if someone is trying to fake bad or fake that they're suffering from a psychiatric condition. Okay. But again, it depends on how high. Okay. Items include like evil spirits possess me at times. True. When I'm with people, I'm bothered by hearing very, very strange things. True. Now, for some people, this may be true. But if they're endorsing every single item, almost every single item like these are just examples. There are again about 30 or 40 items that go to the fake scale that will elevate your scale. But again, it depends on how much. Yeah, so if you're between a T-score of 65 to 79, it may be valid, but the person is they're just really seriously neurotic, or someone suffering from psychosis. Okay, it's really if you're more at about 80 to 99, it suggests exaggeration or malingering. Yeah, and clearly, if it's above 100, you just can't rely on what's being presented on that MMPI. Now, there's another scale which isn't outright lying, but it's more defensiveness. If you keep things close to the cuff, right? The K scale is a measure of that kind of tendency. More subtle attempts to present a favorable impression. Okay, so an item might be at times I feel like swearing, false. Criticism or scolding hurts me badly, false. It doesn't. It's a very growth oriented experience. You know, that person kind of presents, says that kind of stuff. They may not be outright lying, but they just may be the type of person who's just very kind of just defensive. Alrighty, so 56 to 65 suggests, you know, defensiveness, that maybe they're not the most insightful people, aware of themselves. But if it's above a T-score of 65, it suggests that they're faking, right, intentionally, consciously trying to present themselves as being really good, alrighty, without flaws. And again, these four scales, in addition to some other validity scales, are really a hallmark of the MMPI. Alrighty, and makes the MMPI very valuable in the forensic setting. Okay, we'll skip this stuff. And finally, specific domain tests. I'm just going to speak briefly on this. There are hundreds of specific domain tests to measure different moods, psychological conditions, and just other personality traits like assertiveness and so on and so on. Okay, so the idea is that the test, which is usually almost always very brief, measures a specific construct. Now, one of the most common, if not the most common, specific domain test is the back depression inventory, or BDI. Yeah, you will run into this if you haven't run into it already, even just as a student. Okay, it includes 21 items, and each item allows the examinee to respond along a 4-point Likert from 0 to 3. Okay, from 0, not a problem, to 3, a major problem. The psychometric characteristics of the Beck are really good. It has strong, high validity coefficients, correlations, and also really strong test-retest reliability. And it's very good at discriminating from someone who is, you know, kind of bummed or sad from someone who is suffering from a diagnosable clinical mood disorder. So here are examples of items from the Beck depression inventory, right? 4-point Likert. The first item, I do not feel sad. I feel sad. I'm sad all the time and I cannot snap out of it. I'm so sad or unhappy that I can't stand it. Yeah, very simple kind of measure, right? But you can see, right, it does a pretty nice job of measuring sadness along a 4-point continuum. Let's look at a more concerning item number 9. Yeah, suicide. 0, I don't have any thoughts of killing myself. I have thoughts of killing myself, but I would not carry them out. I would like to kill myself. I would kill myself if I had the chance. Yeah. The Beck depression inventory is one of those tests that almost every clinician has in his or her kind of test drawer. Okay, and this is one of the tests that very commonly, um, you know, clinical psychologists might give to an incoming um, client, yeah, the first time they see them, just like when you go to the dentist and they give you a few scales so that they can get a quick and dirty picture of you, idea of you. Well, same thing with psychology. This might be one of those very brief tests you might want to give someone so that you can get a quick and dirty look as to how they're functioning along depression. And one of those items that you might want to go to, those first go-to items, is item 9. Yeah. Another single domain test, which is very commonly administered, is the state trait anxiety inventory. Now, what's besides obviously measuring anxiety, this test provides two subscores. One is concerning state anxiety, and the other is trait anxiety. Okay, so to what extent anxiety is a temporary condition for you, or to what extent it's part of your personality style. Alrighty. Now there are 20 items that go to measuring the state kind of anxiety and 20 items that go to trait anxiety. And just like the Beck Depression Inventory, it's on a 1 to 4 point Likert. Alrighty. And a very handy test. And it's, again, one of those tests like the BDI, you might want to initially, if you're a clinical psychologist, you might want to initially give to a client so that you can get an idea of where they are with anxiety. Okay, with that, that concludes our discussion about projective objective personality test, not projective. That's the next chapter, or chapter down the road. So with that, we'll stop here. And otherwise, I will see you at the next YouTube lecture. All right? Very good. And thank you for your attention. Take care.